Hey everybody, it's Dr. Michele Drake, and I'm here today to talk to you about some senior pet care ideas and thoughts and answer your questions.
Dr. Drake, what is the most important thing to know about caring for a senior dog?
So senior dogs do have different needs. Certainly they're going to be, as they age, they're going to have different exercise, diet requirements, and there's going to be things that a lot of times will be like, oh, they're just getting old when they're not jumping up or they're not moving as well. And we really want to make sure that, that some of these things can be like quality of life things that we can truly help and we can truly address. Also, just things in their body metabolically, their kidney, their liver, their heart. So what we're going to want to do is see these dogs every 6 months. We're going to want to do lab work at least once a year, but on many of the older pets that are 10 plus, we may want to do it twice a year depending on the size of the dog, the breed, etc. And when we're doing lab work, we're looking for things like, again, kidney and liver disease. Urinary tract infections quite often go undiagnosed in a dog. They don't all show the obvious symptoms, although they can. Drinking more water can be a sign in a dog, and it's one of the things I tell people to watch out for. Again, that can be signs of diabetes or kidney disease or liver disease. Any kind of slowing down. When people come in for an annual exam, I start by just saying, tell me about the day in the life of your dog and what is it different from last year. And that's a good place for us to really think about what's going on. Weight is hugely important to keep them thin as they age because weight is so inflammatory for your pet, and we really want to help keep their weight in check.
What is the life expectancy of a dog?
So I would say the average, if we're going to just pick a number, will be about 12, but certainly large breed dogs. Giant breed dogs, it is lower. It's probably closer to 8. Giant breed dogs meaning things like Great Danes or Great Pyrenees or I'm blanking right now. Irish wolfhounds, or just those are giant breeds. Large breed dogs, which are what we mostly see, would be Goldens and Labs and German Shepherds. Those dogs, the average age lifespan will be closer to 10 to 12, and certainly small breeds of dogs can live longer. So they would be more like 12 to even 13 or 14. But we have many of these breeds that will last well into their teens. So it really just depends.
How does getting older impact the health of my dog?
Yeah, so aging itself is not a disease, but of course things like the ligaments in your dog, the metabolism is going to slow down. We start to see problems with, their ability to see. Their oral disease becomes really important in older dogs. They're all going to have some dental disease pretty significantly by the time they're 4 years of age, and if we don't address that on a regular basis, they're going to wind up with having abscesses that are underneath the gum line. You can't see these things. These are chronic sources of infection and pain for your dog, and they're not going to let you know that, so we have to help you figure that out. We see a lot more tumors as dogs age. So there's really quite a few things, and the most important is just to get in here for an annual exam or every 6 months, depending on the age and the breed of the dog.
How can wellness care extend the life and vitality of my dog?
Yeah, so when we do exams, we catch things all the time, like on a daily basis. Heart disease, kidney disease with lab work, heart disease with listening to the chest, lumps and bumps on your dog, and certainly oral health. We find tumors in the mouth, we find tumors on the body. And some of these things are things we can just get rid of and stop the spread of the cancer. So us identifying these things and determining whether or not they're benign or they're malignant and taking the best course of action, we're never going to do anything without your approval, and we're always going to work with you and partner with you to figure out what's the best thing for your pet for the best quality of life for the longest time possible.
Does my dog still need regular wellness exams as they get older?
Yeah, the wellness exams become even more important as your dog ages. We're going to address a lot of things that you're not really aware of. You guys have 1 dog or 2 dogs, and we see like 20 of them a day. And you multiply that by how many years we've been doing this, especially some of us that have been doing this a really long time. We do have a lot of knowledge, and also the fact that we're doctors in picking up things that are going to just, again, it's all about quality of life, and length obviously is important too, but really working on quality of life always.
What are some signs and symptoms that my dog may be slowing down?
Yeah, so obviously slowness to get up in the morning is a really key indicator for neurologic or musculoskeletal inflammation or arthritis, and that's something we really can help with a lot. So I'm going to want to do an exam there. Obviously, sometimes we're going to want to do x-rays too, so we can identify specifically what is going on. Talk to you about the history, how long it's been going on for, what kind of exercise plan do you have, are they overweight? So there's so many things we're going to address that really can impact the quality of your dog's life.
Why is it important to avoid self-diagnosing if my dog is slowing down or whether they are actually sick?
The reason to not self-diagnose is, well, obviously you're not a doctor. and rarely are owners correct. So looking up online is really rarely is it a correct diagnosis. I'll just be honest with you about that. It doesn't mean there isn't some good information on the internet, but there's so much of it that's really you have one small picture of information in one pet, and so to extrapolate that and make that be a diagnosis is rarely correct, and we want to do the best thing. So let's get them in here and we'll work together to come up with a plan.
Last question. What will my veterinarian be looking for when examining my senior dog?
So we're gonna obviously start at the nose and go all the way back to the tail, and we're gonna look at everything. So eyes and ears, and the mouth is super important. We're gonna feel the body wall to look for tumors of any kind. Looking at the skin very thoroughly. We're going to palpate the abdomen, which is where you actually feel the organ systems in the abdomen. And also we're going to listen to the chest. Quite often we're going to do a rectal exam as well, and then collecting lab work and possibly chest films, chest x-rays to have a look at the chest. There's a lot of cancers that can kind of creep up on us, and lung disease and heart disease, and we just really like to stay on top of those for quality of life. So if you have any other questions, give us a call at the Drake Center.